The use of the Montana Jack Scaler for the right-handed operator. We will start on the mandibular left facial surfaces. Make sure you have correct positioning for the unit, chair, patient, and yourself. You should be sitting at 10 to 11 o'clock. The patient's chin should be just slightly up from the occlusal plane, being parallel to the floor, and the head turned to the right. Hold both the mirror and the instrument in a modified pen grasp. Retract the cheek with the mirror when viewing the molars. You may palm the mirror when instrumenting the premolars, and the mirror would not be needed for retraction. Make sure you retract with a neutral wrist and pull back and rest on the patient's cheek. Don't pull forward with a bent wrist and block your light. Next, place your dominant hand with the instrument in it on the occlusal plane of the first or second premolar, with your palm down and a neutral wrist. This will depend on the size of your hand and fingers. We will be working on the first molar. To determine the correct end, place the working end on the distal surface of the first molar as you establish your fulcrum and grasp. The terminal shank of the instrument should be parallel to the long axis of the distal surface of the tooth if you have the correct end. Check out both ends and make sure you keep your fingers of the grasp together. Once you have established the correct end, pivot on your fulcrum slightly so the angulation of the instrument to the tooth is 70 to 80 degrees. You will pull the instrument slightly toward the tooth. You will start your strokes on the distal line angle and proceed distally. Remember, this instrument is for supragingival scaling, so you will not insert to the junctional epithelium. You will, however, take the back of the instrument slightly past the gingival margin if the tissue allows. Make short, overlapping strokes using the lower 1 to 2 millimeters of the end 1/3, always staying in contact with the tooth. You must pivot on your fulcrum finger and rock or roll with your wrist to accomplish this. Your stroke length should generally be about 1 to 2 millimeters. At completion of the last stroke, observe your angulation. Is it at 70 to 80 degrees? Keep your overlapping strokes going until you have covered 1/2 of the interproximal surface. Then gently come out of the interproximal and turn the tip so it heads in a mesial direction. Start the leading 1/3 at the distal line angle again at the gingival margin. Do short overlapping strokes, keeping the lower 1/3 adapted to the tooth until you have reached the midline of the mesial surface. As you come to the mesial, you will have to pivot up on your fulcrum to maintain the 70 to 80 degree angulation. You will then repeat these steps for the next tooth. The next area we will go to is the mandibular right lingual. You will sit between 10 to 12 o'clock. It will probably be closer to 10 for the molars and closer to 12 for the premolars, but will be based on your own body mechanics and patient position. Remember to maintain a neutral position. You may even have the patient turn more towards you if needed. Repeat the steps for positioning the mirror, except now you will be using it for retracting the tongue also. Have the reflective surface face the teeth. Get the correct grasp for both hands and place the fulcrum. The instrument hand should be palm down with the elbow slightly out. There you go. Determine the correct end and begin the instrument sequence. Make sure all the fingers are in contact with each other. The terminal shank should be parallel to the distal surface. Start at the distal line angle and proceed distally. Come out and then proceed in a mesial direction. Next, we will go over to the mandibular right facial surface. You will sit at 9 to 10 o'clock with the patient's head slightly to the left and the occlusal plane parallel to the floor. Make sure the patient is not too high and your shoulders are not shrugged up but are down and relaxed. Get the proper grasps and fulcrums established. Determine the correct end. Make sure you establish correct grasp and fulcrum. Look at the terminal shank. Is it parallel to the long axis of the distal surface? Start your stroke at the distal line angle and proceed distally. Come out and proceed mesially. Watch your angulation on the mesial to see if it maintains 70 to 80 degrees. Pivot and roll and maintain a neutral wrist. The last posterior area of the mandible is the left lingual. You will stay in the same position as the right facial. Use the mirror for retraction of the tongue. You may have to have the patient turn slightly more toward the left. Determine the correct end. It should be the same end as the right facial. And begin your instrumentation. Watch your angulation as you move around the tooth. Make sure you stand up on your fulcrum. We will now be going to the anterior sextants. For the mandibular teeth, we will start with the anterior facial surfaces away. The patient's chin is just slightly up from parallel, and you will be sitting at the 12 o'clock position. To determine the correct end in the anterior areas, the end must wrap in the direction you're going. Place the tip in the direction you are going and see if the bend wraps around the tooth or does it stick out. If you're not sure, check the other end. This is the wrong end. This is the correct end. For anterior teeth, we will start the stroke at the midline of the tooth, not the distal line angle. Place your fulcrum on the incisal edge. Maintain a correct grasp. All fingers should be touching. Start at the midline and proceed in the direction away from your normal side of the chair. In this situation, it would be 25 mesial and 24 distal. Both these surfaces are considered away. Start at the midline, continue your strokes until you have covered 1/2 of the interproximal surface. To do the lingual surfaces away, just place your instrument at the midline, but stay in the same position. You will have to flip ends to get the correct end for the lingual surface. Begin your strokes and keep the instrument adapted. Make sure your fulcrum is on the incisal edge of the tooth and not the facial surface. To complete the other half of the tooth surface, the surfaces towards, sit in the 8 o'clock position with your legs together and parallel. Get the correct grasp with a neutral wrist and your elbow will be slightly out. Initial adaptation begins at the midline of the tooth. Determine the correct end. Does it wrap? Have the patient move toward or away from you so you do not block your light. To do the lingual surfaces towards, sit at the 9 o'clock straddle position. Determine the correct end and begin your strokes. Make sure you reposition your patient chair and light for the maxilla. The maxillary anterior surfaces away are all completed from the 12 to 1 o'clock position. The occlusal plane should be perpendicular to the floor. Determine the correct end for the facial surfaces away. Start at the midline. Have the patient turn their head, or you can change position from 12 to 1 as you move from canine to canine. You may palm the mirror when doing the facials. To do the lingual surfaces away, you must use your mirror and a soft tissue rest. You must also look into the mirror and watch yourself indirectly as you do your instrumentation. This takes lots of practice. Determine the correct end. You should have to switch ends from the facial. You need to feel the instrument pulling into the tooth as you activate the stroke, at the same time as you watch what is going on in the mirror. The tendency is to push the instrument toward the mirror and off the tooth. To do the facial surfaces towards you, you can sit from the 9 to 12 o'clock position. You will have to experiment to see where it is best for you. The canine closest to you may be better toward 9, and the canine farthest away from you may be better closest to 12. Determine the correct end, grasp, fulcrum, and begin your stroke at the midline on the facial. Repeat for the linguals, but you must use the mirror for indirect vision and illumination and change ends. Keep the lower 1/3 adapted at all times. Moving to the posterior sextants. For the maxillary left facial. For the maxillary left facial, the patient's head will be slightly to the right or far to the right. You will be sitting at the 10 to 11 o'clock position and maintaining a neutral wrist. You should be palm up for the maxillary posterior positions. Establish your fulcrum about 1 tooth in front of the tooth you're going to be working on and slightly toward the lingual occlusal surface. Determine the correct end and start on the distal line angle. Activate your strokes. For the maxillary right lingual, you can vary your position from 10 to 12 o'clock with the patient's head more toward the right and the chin way up. Your fulcrum will be more toward the facial aspect of the occlusal surface. As you come more anterior, your position will probably come more toward 12. You will also be using more indirect vision. Start at the distal line angle and activate your strokes. For the maxillary right facial surface, make sure you approach the patient with a palm up fulcrum. You will sit at 9 to 10 o'clock and the patient's head will be straight or slightly to the patient's left. To do the premolars and the facial and mesial of the first molar, you will fulcrum on the first molar and work in front of your fulcrum. To do the distal of the first molar and the molars behind, you will work behind your fulcrum. There is not much space to work in this area, so make sure you activate the stroke on the distals with an open the door stroke and not a close the door stroke. So the blade is opened as it is activated and not closed. To do the last area, the left lingual, you will stay in the same position, 9 to 10 o'clock, but the patient's chin will be way up and far to the left. Your fulcrum will be more toward the facial occlusal, and you will be doing a lot of pivoting on your fulcrum as you move around each tooth in this area. Determine the correct end and adapt at the distal line angle. Go distally, then readapt and go in a mesial direction. Make sure you lean into the lingual from your fulcrum. You've now completed all areas of the mouth.